The Federal Capital Territory Primary Healthcare Board is the agency in charge of the COVID-19 vaccine rollout in the nation's capital. So far, the nation's capital has over 19,000 confirmed cases of COVID-19. Over 2,000 patients are still on admission in the functioning isolation centers across the FCT, and over 17,000 persons have been discharged. 156 deaths have been recorded as of March the 30th, 2021. When it comes to vaccination, of the 3.94 million doses of the Oxford AstraZeneca vaccines Nigeria received in early March of 2021, the FCT got over 227,000 doses, and from its 65 vaccination centers has given the first jab of the vaccine to over 36,000 persons. Health workers like Madam Aisha Galadinchi pound the pavements of the nation's capital daily to increase these figures and ensure the FCT achieves herd immunity by vaccinating at least 70% of its population by the end of 2022.
On Friday, I vaccinated about 250 people, and nothing happened, and they are happy.
There are people that are complaining that the vaccine can have side effects. Do you see anything like that in the FCT?
Nobody. I didn't hear anything like that.
The vaccines are distributed and managed by the FCT Primary Healthcare Board, and its executive secretary says that rollout may be reduced amid fears that the second consignment of the vaccine might be later than the approved 12 weeks.
We are expecting that these people that have been vaccinated naturally have their second dose, and a new supply is expected. But the signals the feelers that we are having from the national is like the supply may not be timely, that may not come at a time, because it should come around June, so that you can give these people their jobs. But it appears they may not have that supply by June, and we are being careful now not to use everything for the first dose. Probably if we use half of that, we do 50% of what we have, we use the other 50 and be the second dose in case the one we are expecting doesn't come. So when you are taking and you have been given the optimum time that you should take the second dose to enhance the effect of the first dose, and then you decide to delay, there will still be some effect, but not up to the optimum that we can say that we guarantee your immunity.
So would you have to probably take both doses again?
Sure, but you have to give yourself some time, probably 6 months. The demand from the citizens are even more. The demands from the citizens are more, and it is shocking. I can't explain that.
So we tested this theory on the streets of Garki, Area 10 in the nation's capital. Just how excited are residents of the nation's capital about this vaccine?
Why will I take vaccine? Am I a COVID-19 patient?
I need the one that is homemade. If there's homemade vaccine, fine. I'll vaccine myself 3 times or 5 times. But if it's outside Nigeria, I'm not interested.
Why I'm discouraged is I went to like 2 places. When I got there, I was on queue. Almost how many minutes? At the end of the day, they said that the vaccine has finished.
This issue of coronavirus, you will take a vaccine and you will still be having a social distance with people. You will still be afraid to shake. You will still be afraid to leave your nose open. Then I'm doubting that, is it true a vaccine or is fake vaccine?
Why are you minding vaccine from China, vaccine from... Do you know the source of that vaccine?
Not so much. Although not everyone is buying the conspiracy theories. At the Garki Area 2 vaccination center, these respondents are excited about getting their vaccination.
I feel normal. I don't feel anything, no numbness, nothing. I was expecting it to be more like the injection, but it doesn't feel anything at all.
To me, if I want to be a conspiracy theorist, if you're trying to get all of us in trouble, world leaders wouldn't be taking the vaccines.
The vaccination process is simple. You register your details and the staff makes sure you're eligible to be vaccinated.
According to what they said, it's from 18 years and above. So if they are still breastfeeding their babies, I don't think the baby will be safe.
After you're captured, you make your way to the nurse who administers the painless jab. and your vaccination card is given to you as you wait for the second jab to be administered in 12 weeks. Kayla Megwa, Channels Television News.
For more on the situation in the FCT, Dr. Mohammed Kawu, Acting Secretary, Health and Human Services Secretariat of the FCT, joins us now from our Abuja studios. Welcome. Thank you for joining us on the program.
Thank you so much.
So from that report, we saw lots of skepticism, conspiracy theories, but how would you describe the rollout of vaccines in the nation's capital?
The rollout in the nation capital is going on very well. Since Monday, 15th March, when we flag off with our minister and the strategic leaders and the frontline health workers, the vaccination has opened in all the 65 vaccination points across the territory. And people have been trooping to get vaccinated. I have been vaccinated since then. My family have been vaccinated. All the strategic health leaders in the territory have been vaccinated. So far, so good.
Now, we know the FCT received over 200,000 doses, and we've been told that, the consignment of vaccines might, not be delivered in time for the second dose, and for AstraZeneca, it should be between 4 to 12 weeks. How big a threat is this in the fight against the virus?
Thank you very much. You just had the ES of the FCT Primary Healthcare Board expressing some maybe reservation, and probably is being cautious, so that it's not that when those that receive the first jab, their time for the second jab will be ready and the vaccines are not available. So that is why here in FCT we are going to be very, very careful. We will ensure that we have vaccines available for those whose second dose will be due. So it won't be an issue of having somebody ready to get the second vaccine and the vaccines are finished. We have assurances from the Federal Ministry of Health and the National Primary Health Care Agency that we are going to have the second consignment. When is the issue, considering what is happening across the world, where all nations are trying to conserve vaccine for their citizens. So to be doubly sure, to be extra careful, here in FCT we are going to use 50% of the 228,400 that has been given to FCT and the federal agencies in the FCT while we wait for the next consignment to continue. And I can assure you in FCT, this quantity is going to take the first phase and the second phase. First phase being the frontline health workers and all health workers and not health workers that are working in the health facilities that are most exposed in this pandemic. And the second phase, which is 50 years and above that have comorbidities. So we are confident that this quantity is going to go a long way in attending to those people that are in the first phase and in the second phase, while we anticipate the second consignment. Thank you.
Finally, Dr. Kawu, before we let you go, how receptive are frontline healthcare workers with the vaccine?
Yeah, surprisingly, there are some vaccine hesitancy in some health workers. I was also surprised, especially those working at the PSCs. Those working at the tertiary hospitals and the secondary healthcare facilities and the big private hospitals are trooping to take. But those health workers that work at the primary healthcare, at the interior, they are really having hesitancy. But that I can assure you, we have gone out to engage them and to tell them the importance and the implication of getting this COVID-19 vaccine. So we are getting good response, but initially there were some hesitancy and resistance.
All right, we'd like to thank you, Dr. Mohammed Kawu, Acting Secretary, Health, Human Services Secretary at the FCT. Thank you for joining us on the program.
Thank you so much. I appreciate it.